Hi student, good morning. So already I have share a link in group. So let him join. Please wait everyone. Minimum 10 members join me. We will start the discussion. Okay. So just wait for 2 minutes. Let him join. We'll start. Today we will discussing about that how to make a nursing diagnosis with easy way and how to make a nursing care plan also. Okay. So very important topic. So this is mostly important for the first year and second year GNM. Okay, so both student can join today live session, first year and second year both. Okay, I have sent it both group itself, so let him join 10 members. We'll start. Okay, 4 members and you can share it your friend cycle also, your classmate. So it will be going to useful for you how to make a nursing diagnosis and how to make a nursing care plan to easy way. Okay, I'll give you easiest formula to write a nursing diagnosis. Okay, only 4 members. So shall I start? So everyone just I am audible, my voice is clear, just put in comment. My voice is clear. Okay, my voice is clear, just put yes or no. Just put in comment yes or no. Okay. Okay, thank you for feedback. So first topic is how to make a nursing diagnosis to easiest way. Okay. So 11 members almost join. So we are going to start. Okay. So the first topic is how to make a nursing diagnosis in easiest way. Okay. So I'll give you that formula. So this is the formula. Okay. So this is the formula to make a nursing diagnosis to easiest way. So each and any nursing diagnosis you can use this formula. What is the formula? First you have to put a dash related to related to disease condition dash as evident by dash. These 3 dash you have to fill and you can make any sign and symptom diagnosis. Understanding? So 3 dash and this word you can use anyway. Okay, the formula is dash related to disease condition dash evidence by dash. So this is the formula. Okay, this is the formula you can use anywhere. So this dash related to disease condition dash evidence by dash. So these 3 dash you fill means you can make a nursing diagnosis to any sign and symptoms. Okay, so I'm going to fill and show you how to fill this dash to easiest way. Okay, so same going to the see I am already put that next steps. So we are making a nursing diagnosis to pain. Okay, so first dash I am written acute pain related to what I am already mentioned. You can here put any. So if there are any sign and symptoms, you can put disease condition. So no need to give this dash. Okay, so that's why I am putting acute pain related to disease condition. So this dash is no need. in that condition. So as evidenced by same mention. So in the dash, what I feel? Facial expression and pain scale. Okay, so easy. So for that sometimes, so this is the two option. This is the one and this is the two, and this and remaining these two is compulsory. These two dash is compulsory, and some of the disease condition you can only use the disease condition, or if there are any other specific you can use this dash. Otherwise disease condition is enough for easiest way. Okay. For the acute pain, what I mentioned, acute pain. So same related to what I mentioned, disease condition. So same mention related to disease condition, as evidenced by, same as evidenced by what, how we are evidence for the facial expression or patient pain scale assessment. So during the time of assessment of pain or facial expression, we are going to get identify the patient has a pain. Okay. So next I am going to discussing another one more care nursing diagnosis like fever. So in that condition we are using 3 dash, 1, 2 and 3 dash. So the first dash is what is fever. So we can write a hypothermia, or you can write a increase the body temperature. First dash, this first dash you have to write a hypothermia or increase the body temperature, anything. So same I am going to copy related to. So in related to you can mention disease condition also, or you can mention what is the causes. Fever, why it will be happen? Due to the infection. So that's why I have mentioned infection process. Okay. If you don't know that causes also, you can just put it in disease condition only. Okay. Same it copy here and put it here. Hypothermia related to disease condition, or if you know the causes you can mention that infection process, right? Same next, hypothermia related to what, infection process, as evidenced by patient body temperature, and you can mention that body temperature also 99/100 Fahrenheit. So like any other diagnosis like dehydration, so the sign and symptom will be dehydration. How we are writing? So in that first dash you are writing, what you are writing? Fluid deficit, right? In that first you have write a fluid deficit related to what? You can write a disease condition, or you can write a what you in the dash you can write decrease oral intake. So dehydration, why it will be happen? Due to that improper intake of water. So due to that dehydration will be occur. So if you don't know the causes, you can just mention it disease condition. So what, as evidenced by what? By dryness of lips, say, or dryness of skin, or by checking the intake output chart. So like this you have to make a care plan. So I hope it will be very easy way. So just put comment, it will be understanding or not. So this formula is useful or not. Comment and tell. If you're not understanding, I'm going to explain again. Comment. Are you understand? Or once more explanation you want? If you want, I'll explain again also. Can I explain again? Okay, I'll explain one more time. So clearly it will be goes to your mind, and during the time of exam, like within a second you are making a care pen and write it in exam. Okay, so this is the formula. Dash related to the disease condition, you can mention a disease condition, or in the other option will be fill the dash. Okay, this is the two option, you can use any one. Dash related to the disease condition, dash related to the disease condition, you can make it two option, you can use any one, and as evidenced by dash. So this is the formula. For the pain you are using like acute pain, first dash will be fill related to disease condition I am using here. See, related to disease condition, same after that we will copy as evidenced by what? In this dash I mentioned facial expression and pain scale. So all nursing diagnosis will be completed. for the second scenario, what I mentioned, I feel that three dashes. Okay, the first dashes will become hypothermia. I'm going to make a fever diagnosis. So you can make a hypothermia means increase the body temperature, or you can mention it increase body temperature if you don't know the medical term. Okay, so related to same I am copy here related to, in that I am not using disease condition, I feel that this dash. So in that dash why it will be happen, you can, this is a causes. Okay, in that dash it will be mentioned causes. In that causes I am mentioned infection process. So due to the infection the fever will become, so that's why I mentioned hypothermia related to the infection process. Same I am copy had as evidence by, in the last dash I feel how I am evidence by checking the body patient body temperature. Okay, so this is very easy way to make a diagnostic diagnosis. This formula only, this formula, sorry, this formula only if you remember means you can make a diagnosis to any sign and symptoms. This is the most important. Okay, so any other diagnosis like discomfort, yeah, discomfortness also, or fluid valley deficiency, anorexia, uh, anorexia or sleeping disturbance, any sign and symptom diagnosis. Sleeping disturbance I am going to make. See, in that first dash what we are writing, disturbance in sleeping pattern. So this is the sign and symptoms I am going to write here. In disturbance in sleeping pattern related to what, related to patient pain or patient disease condition only you can mention it. Okay, in that dash is no need, already I am taken disease condition, same as evidence by, and last dash I am going to feel like redness of eyes or facial oral verb by verbalize with patient. Okay, so like this you can make a care plan to any sign and symptoms to any diseases. So this is the easiest way to make a nursing diagnosis, so for any sign and symptoms. So I hope it will be helpful. Just to put in comment if you have any doubts. Is that clear? Just a seconds. Next topic will be how to make a nursing care plan. Okay, so I'm going to discussing about the like how to make a nursing care plan of easiest way. Just hold 1 minute. I'll explain this one. Hi student. Sorry. So we're going to discussing about the how to make a nursing diagnosis. Okay, to easiest way how to make a nursing diagnosis. So in that nursing diagnosis already you have studied. I hope you all are studied it in first year or second year also. steps of nursing process. So in that we have a 6 steps, right? Assessment, diagnosis, goal, planning, implementation and evaluation. So this is the 6 steps of nursing process, right? So in that only, by using these 6 steps, we are going to make a nursing care plan for the patients for any specific disease condition or any specific sign and symptoms. So for easiest, I am going to make a fever care plan for the patients. So same like this, you have to make a table in that: assessment, diagnosis, goal, planning, implementation and evaluation. So this is the 6 steps. Same way you have to make these 6 process, and one by one how to fill and how to write this care plan I am going to tell you. Okay. So first is the first column is what? This is the first column. This is a assessment. Okay. So in that assessment we have a 2 portion, right? First one is the subjective data and second one is the objective data. So how to write a subjective data? Like how we are communicating. Same way you have to write. Patient said as I feel weakness or sweating. So in that, this is the fever subjective data. For acute pain also you can mention patients say that I have a pain. Okay. Or patients say that I have a pain my leg or any particular parts. Or patients say that I am disturbed in sleeping pattern from yesterday. Like this, the oral communication you have to mention in the subjective data. And what you have to write in the objective data? In the objective data you have to write what you observe. Okay. So always you have to write by observing the patient body temperature. So this is the fever. If that pain, you have to write by observing the patient facial expression. If it is dehydration, so you have to write by observing the patient intake output chart. So if it is sleeping disturbance, you have to write by observing the patient's eyes, redness of eyes. So like this, how you are observe the patient have a that complaints. So if you are going to the patient side, what are the symptoms you seen, and because of that symptoms you are going to identify that patient have a that kind of problem. So this is the objective data, what you observe you have to write, and subjective data it means patients what they complaining or patient what say, that one you have to write. So this is the difference between subjective data and objective data. I hope understand, it will be clear what you have to write in the subjective data and what you have to write in the objective data. It clear? You want again explanation? Just put it in comment. If it is clear, I am going to the next steps. Subjective data means patients what say, like what patient complaining, like patient say I have a fever, I feel a pain in the leg side, or start a night I am not able to sleep, difficult in sleep, I am not able to eat food properly. So like this, what patient complain, you have to write in subjective data. Objective data, what you observe. After complaining the patient, you are going to the patient side and observing, by observing your eyes, what you observe, you have to write the objective data. So I hope it will be clear. If you have any doubt, you can tell me. I'll explain again. So here I am going to the next steps. It is the nursing diagnosis. So in the nursing diagnosis, like we are making the nursing diagnosis, that same nursing my diagnosis you have to copy here, copy and paste here. Same nursing diagnosis you have to copy and paste here. For the fever I am making like this na, hypothermia related to the infection process as evidenced by the patient body temperature. If it is pain, you have to write a acute pain related to the sorry, just a second. If it is pain, you have to write a acute pain related to the patient disease condition as evidenced by patient facial expression. So same nursing diagnosis you have to copy here. And next step is the goal. What's your goal? Like depend on the patient complaint, what's your goal? In case patient has a fever, your goal would be to reduce the body temperature. In case patient have a pain, your aims will be to reduce the to patient pain. In case that intake output will be very less, so your goal will be what? Your goal will be to improve the IO chart, intake and output. So depends on the nursing diagnosis, you have to make a goal. In case if it is fever, so your goal will be to reduce the body temperature. In case it is the pain diagnosis, your goal will be to reduce the pain. Like this, you have to make a goal. What's your goal? You have to write. Next, we are going to the next steps. So that is planning. So planning means what? Implementation means what? And evaluation means what? Planning means what your plan. Like patient have a fever. What are the things you are going to give the patient? So that's your plan. Like before giving care to the patient, you have to create a plan. Like this I am going to do. Like first I am going to check the patient vitals. Okay. Then after that, if the patient have a fever, I am going to give a patient comfortable position. Next, patient fever have, so I am going to give a rapid sponging. And last, I am going to give a medication as per doctor order. What are the doctor is prescribed. So that is planning. I am not going to give the patient. These things I have planned. These things I am going to do. So what is implementation? So after planning, so I am going to do like according my plan to implement to the patients. So that is called a implementation. Like in the planning, I am thinking I am going to check a vitals to the patients. So in the implementation, I have to write I have already checked the vitals. Okay, so that's why to assess, and in the implementation assessed ed will be job. Planning to assess means I am going to check the vitals, and implementation you have to mention I have already checked the vitals. In the planning you have to going to give a patient comfortable position, and in the implementation you have to write a already I have give the patient comfortable position. In the planning I am going to give a sponging bath. In the implementation I am already given the sponge bath to the patient. Okay, so in the planning I am mention medication administered as per doctor order. I have create plan. And in implementation you have to write medication administered ed will be job. So already I have given medication as per doctor order. Like what are the create your planning, implementation will be going to do and implement with patients. So that is called your implementation. So all same you have to copy will be ed, and as per your planning you have to make a implementation. Okay, so what is evaluation? So this is the last stage of nursing care plan. This is called evaluation. So evaluation means after giving all cares, like already you have give what you plan, already you have applied to the patients, and at the last implementation is also called a feedback. Okay, so implementation is also called a feedback. Okay, like after giving all those care to the patients, what is the patient condition now? So that is called implementation. So this implement that is called evaluation. Like for implementation we are going to plan to checking the vitals to the patients, to giving compatible position to the patients, to giving sponging bath, to giving medications administered as per doctor order. Like after giving all those care, the patient body temperature will be decreasing. Now the patient body temperature is 99. At the starting the patient body temperature will be 102. So that is our evaluation. Like after giving all those care, how the patient current condition, the patient fever will decrease or not. If it is pain care, the patient pain will be decreased or not. So that is the evaluation. Like what I mentioned in the evaluation, patient body temperature reduce at some extent. Yes.
ఇండక్షన్
So, is there any doubt? If you have any doubt, you can just put it in comment. So this is the easiest way you have to write a calplan to in your exam. Okay. So like this format you have to follow. You have to make a nursing diagnosis and you have to make a nursing calplan. So this. So I hope it will be helpful. So if you don't have any doubt, I will close the live. If you have any doubt, you can just ask me now. I'll try to explain again. Any doubt? I hope no. Okay, thank you so much. Study well. If you have any doubts, you can just put it in comment or put it in message group. Okay.